Now I'm going to prepare a blood and tissue biopsy for preparation to go out to our outside lab. I've already pulled our blood sample, and I'm going to put it in the centrifuge in order for it to separate the serum from the red and white blood cells. And while that's spinning, I'm going to prepare our tissue biopsy. This was removed from a left thigh of a Rottweiler mix, a subcutaneous mass. So I already have the lab information. It has the clinic, the doctor, the patient name, the signalment, or the owner name, the signalment of the patient, and the information of what from the biopsy, and then the test we would like to run on it. So the tissue is in here. We have formalin in this jar, and it's already marked with the patient's name. Make sure the size of the specimen is at the right thickness for the formalin to penetrate it. I'm going to drop it in there. Close this. We have the bag that goes outside. Put the biopsy in the bag, and then fold the paper in with it. And this is ready to go out to the lab. Now that our blood sample has spun, you can see the blood cells under it and the serum above it. We're going to put that into the same bag that the outside lab sends us. And I already have the information sheet for that as well. Put it in with the tube, and it is ready to go out to the lab as well. This is our Vthz CBC machine. Every morning we have to run a blank on it, where no blood sample is in the slot, and then it just runs blank fluid through the tubes to kind of clean it. About every month we have to change our reagent pack, which has the dilutants and everything to measure the red and white blood cells. What we do is we unscrew each of these little pods, and we run bleach through all the cords to disinfect them. And then we have our new Vthz reagent pack up there, and then we hook it up, and then we run another blank through it. We also have to clean the portals in the back. Sometimes they can get dirty and clog up. And then we just maintenancely every day wipe it down, make sure there's no dust on it or anything like that, and it should be good for running more CBCs. I'm now going to perform an ELISA test. This is a heartworm test. I already have my blood sample pulled, and it's an anticoagulation tube. The actual test, and then it has a pipette in here to pull your sample. To mix it, it calls for 4 drops of their buffer. And 3 drops of blood. Okay. And then you mix the two together. you pour it into the well of your heartworm test. Making sure there's no clots or anything in the blood in the sample. You're going to wait until it fills the well and into the eyelet on the top, and then when you first see that, that's when you'll snap the test down. Okay, and after you snap it, you'll wait 8 minutes. And then your control dot will come up, and then if it's a positive, then the dot on the left will appear. So Duke's been shaking his head for a couple days, so I'm going to use a clean cotton swab and gently insert it into his ear canal to get some of the matter out to see what's going on. I'm going to lift his ear up and gently place it into his ear and roll it. And then we'll go stain this and prepare it. I'm now going to prepare my swab that I just got the sample from to be stained. So to transfer the matter from my swab, I'm going to roll it on the slide. And then I'm going to heat fix it to it. To open my stains. And going from left to right, I'm going to place it into it 13 times. Wash it off. And then let it dry. Now that our slide is dry, I'm going to use the microscope to evaluate it. I'm going to start on 4 power and work my way up through the powers and focus it each time using my coarse and fine adjustment on my microscope, and so I can look at it at each step. When I'm looking at the sample on the microscope, I go in a line of down, over, and up, down, over, and up, so I can get every section of the slide. Okay, so what I found was there was some epithelial cells and there was some bacteria and yeast, which may be indicative of an ear infection, and I would consult one of my doctors for further treatment of the patient. And go. When performing a necropsy, you want to make sure to wear the proper PPE, the mask, the gloves, gown, foot covers if there's possible hazardous material involved. We have our instruments set up like tissue forceps, scissors, scalpel blade and handle. Dr. Kimberlin has already made a decision through the medial line and is in the process of getting a part of the liver to biopsy. I have 10% formalin in this jar. And that'll be sent out to an outside lab. When necropsy, you want to look at all the organs, the liver, the kidneys, the GI tract. You can open the ribs up and look at the heart, the lungs. You can sample the sciatic nerve. When getting samples for rabies submission, you want to make sure to protect yourself as best you can, wear the gloves at all time, wash your hands when you're done. When you send those out, you want to cool them with just their head in the box. We put it in an overnight shipment down to Austin, where it is submitted for rabies, and we get the results back in a couple of days.
You want the plan?
We're gonna do a vaginal cytology on our beagle. Roll the vulva up to give him a clean entrance into the cervix. He's going to look around, make sure everything looks okay.
Hold that up for me.
Pass a cotton swab into the opening to get a sample. And we're going to roll it on his microscope slide.
One more.
I'm now going to prepare the slide, the sample for staining. I'm going to roll it on my slide. I'm going to stain it in each stain cup, 13 dips. We'll let it dry and then look at it under the microscope. We're now going to evaluate the cytology sample we just took. The stages of estrus start with anestrus. This is where the female has no physical changes and does not accept males. Lasts for about 2.5 months. You have some intermediate and parabasal cells, as well as some bacteria and neutrophils. When they go into proestrus, this is when they have the swollen vulva and the bloody vaginal discharge. It lasts for about 7 to 10 days. They start to have some cornified squamous cells. When they go later into the late proestrus, the neutrophils begin to go down, the erythrocytes begin to go up. When they move into estrus, this is the time where they still have the swollen vulva, and the blood discharge turns from red to like a pink straw colored discharge, and this is where they accept males. This lasts for about 7 to 10 days. They will have mainly cornified squamous cells, some neutrophils and erythrocytes and bacteria. Then they go into diestrus after that. This is where they still have a little bit of the swelling and a little bit of the discharge. They won't accept males. In the early stages, they will still have some cornified squamous cells. When they move into later diestrus, they start to get back their intermediate and parabasal cells. When looking at the cytology we took today, she has mostly cornified squamous cells and some erythrocytes and neutrophils, and determined that she is an early to intermediate estrus and that she's ready to be bred today. I'm now going to perform my cross-match agglutination test. I've already drawn blood samples from my patient and my possible donor, both an EDTA and a serum separator. The serum separator blood has clotted, so I'm going to place them, all 4 of them, in the centrifuge to be spun down. And wait 5 minutes. The centrifuge is finished spinning, so I'm going to take the tubes out and first transfer the serum from the serum separator tubes into regular red top tubes. I'm now going to wash the erythrocytes in the EDTA tubes. I've already centrifuged them, so I'm going to take the plasma off the cells. Okay. And then I'm going to take another pipette and put 2 drops into a glass test tube. Okay. Now I'm going to wash them. I have 9% saline in the syringe, and I'm going to fill it up, and I'm going to do this a total of 3 times, centrifuging it at a minute per time. Mix it gently. I'm now going to make my erythrocyte suspension. I already have 2 syringes of 0.98 mils of saline pulled up. I'm now going to measure out 0.02 mils of the erythrocytes, the washed erythrocytes. 0.02 in here, and then this one is our recipient. So I'm going to put the erythrosites in here. And then put in the saline. I'm going to repeat this process with the other sample. I'm now going to pair the recipient and the donor samples together, starting with the major combination. So I'm going to take 2 drops of the recipient's serum and 2 drops of the donor's suspension. And then for the minor one, I'm going to take 2 drops of the donor's serum to 2 drops of the recipient's suspension. For the control, the 2 controls, I'm going to pair each sample from the same patient with 2 drops together. Now we wait 30 minutes. Okay, so all 4 tubes have incubated for 30 minutes and I've already centrifuged them for a minute. And upon examination, there's no agglutination in the major or the minor tubes. So I'm going to put a drop on a microscope slide to examine it with the microscope. So I'm starting at the lowest power, and then I'm going to work my way up to the higher powers, focusing it as I go, and darkening the contrast to make it easier to see any agglutination, microscopic agglutination. So upon microscopic examination, I found no agglutination, so the donor dog would be a right match for our patient to receive a blood transfusion. I'm now going to do a skin scraping on Miss Tracy. I already have a microscope slide of mineral oil and a sterile blade. I'm going to put a drop of the mineral oil on the slide. And then I'm going to dip my blade in it to coat it good. I'm choosing the stifle area. I'm going to pinch the skin. If there's any like Vthz mites, it'll push it up out of the hair follicle. I'm going to run the blade on the skin until I get a little bit of blood back. And then once I have some, I'm going to put it on my slide. And we'll usually do this in 2 to 3 different spots.
Go.
Okay, so I put a cover slip on the slide that I just took the skin scrape samples on with the mineral oil and everything on it. When examining skin scrape samples, you're looking for mites like sarcoptic mange and Vthz mange or red mange. The Vthz mites are the longer, thin ones. They kind of look like alligators in the microscope. Those are going to be your most common ones. They live down at the base of the hair follicle, which is why you need your sample spot to bleed before you stop scraping it. Sarcoptic mites live more toward the top of the skin layers and are easier to find, but aren't as common. Upon evaluation of this sample, I didn't find any traces of either one, no bits and pieces or dead ones. If we did happen to find any evidence, we would treat them for several months and do routine skin scrape rechecks to see how the medicine's working.